You just have to accept that there is COVID in Uganda. This is not China, this is not Italy, but Uganda, where you also, we have COVID within our Uganda.
Sam Gombya is a musician, radio presenter, husband, politician and social activist for people living with disabilities. Gombya says he is lucky to be alive after suffering from coronavirus. He managed his condition at home with the help of a qualified medical personnel and is appreciative to God for seeing him through his sickness. He says that he had splitting headaches with his body on fire, prompting him to go for a checkup at the hospital. Gombya says that he was ready for any eventuality, but upon receiving the results, everything changed.
On receiving the results that I'm positive, things started changing a little bit. So I started getting some symptoms that I didn't even had before. The body started itching, by the way. The body started itching, and then I said, yes, this is COVID now.
Because of fear and anxiety, using his prescribed dosage by his physician, he bought drugs for the entire family.
So I had to buy that kind of medicine, which took around 700,000 shillings. Sweet. So why? Because I was scared. And I thought also my family needed that. You don't know, because we've been together before isolation and whatever. We've been together sharing this and that, eating together, so I thought we are all sick.
He was self-isolating at home from the rest of his family, but eventually his wife Sophia Gombya contracted the virus, but children were lucky not to be infected.
But I looked at my children, they were taken. And the daughter didn't welcome the news very well, and I saw her face. But I told them I'll be fine, there's no problem. And then eventually, she also got some symptoms after a while, after some 2-3 days. And we found out she was also sick.
Gombya felt so lonely and also thought that he was about to die. This made him to almost share his secrets with wife and family.
I got some difficulties in breathing, and then I said, yes, this is the last symptom now. So I thought, man, I'm going to die. And in there, that's when you come up with the secrets that you had kept to yourself. I said, no, man, I have to disclose my secret.
Gombya says he got nightmares of him being buried.
You start dreaming about your death, you dying, taking you for burials and whatever. That kind of dreams.
As many COVID-19 patients are charged exorbitantly, it was a different story for him and family as they opted for home care treatment.
We used up to 5 million, not because we would have used that money, no, because I was a little bit extravagant, because I was scared of the disease. Like the medicine I bought is still at home. Because I bought a lot, whatever they tell you to. I even changed the doctor's description. He described a certain medicine, and then I went on changing because I had listened to another person.
He appealed to Ministry of Health and Health Centers to change the way they relay COVID-19 results to their patients, since people are in panic.
From the blue, you're positive. Next. So what, how have you left this one? What if he goes out without being inducted into it? You will find a problem to embrace the entire COVID whatever. He has to. So, but if you prepare him that, yeah, no, like the doctor talked to me, he talked to me nicely.
Sam Gombya has a special message to the people still battling coronavirus and the nation at large.
Accept it. Do not doubt that maybe the doctor this, that. Go according to the doctor's advice. If it is medicine, take it the way he has described it to you. Don't think that you're jakubera bulungi without taking the doctor's advice.
As of 16th July, the Ministry of Health had registered 89,080 coronavirus cases, of which 2,249 had passed on and 64,096 recovered.